each and every Gambian know wherever the vulnerable are being, affected, we are there to make sure that we alleviate their sufferings. And this is why we have secured a funding from the International Federation of Red Cross and Red Crescent Societies to further sensitize the general public that the Red Cross is here and it is here for the vulnerable. But we are here to advocate, to say that decision makers are very much important in the lives of the vulnerable. And when we say decision maker, this is not just only at the central level, meaning the President, His Excellency, whom we are very much happy, and who is also supporting the National Society and his cabinet. But at the same time, at the regional level, you have the governors, and then you have the various institutions at regional level as well. But even at community level, even at household level, people are there, decision makers. They take decisions on behalf of the vulnerable. This is why we are here to advocate that any decision that is to be taken, it has to be taken to the interest of the vulnerable by improving their lives and also reducing their vulnerability. Because without which, at the end of the day, every day we will be there to help them. But the decision making is very vital. And as a result, that's why we are here to sensitize and advocate on behalf of the vulnerable that any decisions that have to be taken, it have to be to their interest. And that's why we are here today, and my fellow colleagues will dilate more on our thematic issues. But as a result also, we are intending by on the 27th of this month, which is Thursday coming, we will be having a seminar, and this will be inviting stakeholders. This is not just only a Gambia Red Cross Society show, because when you talk about vulnerables, it's not just only Red Cross. We focus on specific areas, and there are other institutions that also focus on specific areas. And our Alliance Ministry is the Ministry of Health, will be there, and then we have other stakeholders as well. So it is vital that we all come out in our numbers, and also come out to attend and listen, and as well as also contribute. Because when we talk about vulnerable, today it is you, tomorrow it could be somebody else. And today is somebody, and then tomorrow it is yourself. So we are here for each other. So that's why we are advocating that any decision that we are making, it has to be for the vulnerable.
Thank you very much, Mr. Nget. We'll come back to you. Let me have Boba Dabo, the Disaster Management Coordinator, to elaborate on his work as a volunteer.
Thank you very much. As you already said, I am the Head of Disaster Management and Food Security Coordinator for the Gambia Red Cross. Katim has been talking about vulnerability and the vulnerable people, that the very existence of the Red Cross is as a result of the vulnerability and for the vulnerable group. And this vulnerability comes in different forms and in different ways. The majority of the vulnerability that the Gambia Red Cross operates on were as a result of disasters, as a result of health epidemics, and this my health colleagues will talk about it. My focus would be the vulnerability that are due to disasters and vulnerabilities that are due to food insecurity. When we say vulnerability, vulnerability levels differ from one person to the other, from one community to the other, from one region to the other, and also from one country to the other. And as a result, when we are doing our intervention, we do what we call prioritization. And this prioritization always comes when we complete our assessments. And this assessment report would inform our decision as the National Society who is a vulnerable person that we are going to prioritize first. And this is also based on the resource availability. And the Gambia Red Cross over the years has been supporting enormous sectors of people. Various level of intervention has been done by the Gambia Red Cross in different parts of the country.
Can you please name some of them?
2010, for example, we have supported the flood victims in LRR, we have supported the flood victims in NBR, in Western Region, and URR. Specifically 2012, we have supported 51,000 people on immediate food assistance. And this, our approach was twin track initiative, meaning we supported the people on emergency base and also include what we call the long-term recovery and resilience by providing these very people fertilizer and seeds, at least to have grown something that would be substantial for the family. This is what we call the twin track. We don't only look at emergency phase, but we have gone beyond the emergency phase to include the resilience of the community. And this is the paradigm shift in disaster management nowadays. People don't only look at what did you offer at the immediate
In other words, you don't give the fish, but you show them how to catch the fish.
How to catch the fish.
Excellent.
This is now the
I
focus.
think, Buba, we can stop there. I will come back to you.
Thank you very much.
Go to Fatou Gay, the HIV and AIDS coordinator, to elaborate on the health issues that they help in this country.
Thank you very much, Kadjetu, and good evening to the viewers. When you ask people, what do Red Cross do? The first thing they say is they offer first aid services. When there is accident, that is what they do. Buba had said a little on what we are doing in terms of disasters in the country. As Katim has says, our line ministry is the Ministry of Health. And the Gambia Red Cross is out to support the government in whatever they are doing and as little as possible. If you look at the health, whatever we do it in close relationship with the Ministry of Health. Some of our activities are first aid. We do first aid, offering out first aid to the people, training people on first aid. Because if you look at the Gambia, many people, everybody wants to help, but definitely some of them, in terms of accident, they don't know what to do. So what normally happens is, even if there is one first aider within an accident area, the person may not be able to do what he or she is supposed to do because people want to help, they don't know what to do, and they don't let others do what they're supposed to do. So what we are looking at is how best can we train, especially drivers, especially police, because they are always at accident spots. So how are we going to train them so that they can also give support? How are we also going to train people who are within industrial areas where, you know, sometimes there are accidents there? So first aid is one of the activities that we do. We also into HIV and AIDS. We offer home-based care for the sick and those living with HIV. We also do prevention activities. We call it stepping stones, going out to the community, working with the community, letting them understand the disease, and they plan for themselves how to intervene in terms of HIV and AIDS, which had been very, very successful since we started. We are also into disease prevention. We are working very closely with the Ministry of Health in terms of National Immunization Days. We go out on social mobilization. I think people will bear us witness, seeing people, Gambia Red Cross volunteers on T-shirts, going from compound to compound, sensitizing the people, telling the people that they should get out, take their kids to the immunization centers, which has been very, very effective. Because if you look at the Gambian immunization rate, definitely the Gambia had scored a lot thanks to the Ministry of Health. And we are also into sensitization in terms of common diseases like malaria, pneumonia, you name it. And we do go out to communities, discuss with people, sensitize them. We have come up with a strategy called the Community-Based Health and First Aid. This is called the CBHFA. The CBHFA goes out to the community. Right down there at community level, you have volunteers from that community who will work with the community in terms of disaster, in terms of health prevention, in terms of health promotion. And we do this closely with the Ministry of Health and other stakeholders at community level, which has definitely proven successful, and we want to expand on it. Because as the Wolof says, ndimbal na ca feka loxoy borom.